So here's a dental school story. I'm pretty sure it was the first, maybe the second year of dental school, and we're not working on real patients yet. We're still working on these things called typodonts, these like fake mannequin teeth, and you stick inside this little mannequin and you drill on those plastic teeth a bunch of times before they ever let you touch a patient. Anyway, I remember we were working on top teeth, so the top jaw teeth, and to see those and to work on those in the mannequin, you have to use the mirror. So everybody knows the little mirror that the dentist has. Well, learning how to use that thing is very tricky. In dentistry, they call it indirect vision. I haven't said that out loud in many years, just realized. Anyway, I was struggling with indirect vision, and I asked some of my classmates,
Like, hey, how are you doing with the mirror? How are you struggling with your indirect vision?
and most of my classmates,
No, it's fine. Doing fine. It's easy.
and I was like thinking to myself, wow, I'm struggling. Like, I am really not doing well with it. I have to cheat and turn my head and look with my eyes and not use the mirror to get the procedure done correctly. I didn't fully trust that my classmates were being honest with me, the ones that told me that they were having no problem with it and it was easy. A lot of people at that level, a lot of dental students, and just anybody that gets into that high into an academic career or that advanced into an academic career, usually a typical personality trait that goes with that is not ever wanting to show weakness. So even if you are struggling with something, you probably don't want to admit it to your colleagues, which we all know is an unhealthy trait, but it's a common trait in that professional world and in the dynamics of how that world exists. At least it was at the time I was there. Anyway, I remember asking Dr. Lippman, he wasn't the dean then of the school, I think he's the dean now. Anyway, I remember asking him, I said to him, when did you finally get comfortable in your career with indirect vision, looking in the mirror, working on teeth while looking in the mirror? And I was expecting him to say, 6 months, 1 year, something like that, just to give myself some kind of idea about when I might feel confident myself in it, because I wasn't feeling confident in school at that moment. And I remember he said to me, probably like around year 10 of my career, and it blew me away. 10 years? 10 years, are you kidding me? But I was so glad that he told me that, and it really changed how I felt about where I was at in that moment, and it helped give me perspective for the first 10 years of my career too. Because here was this guy that I really looked up to, admired as a professional, just the way he carried himself, and here he was admitting to me that there was a skill that it took him 10 years to perfect. And meanwhile, I'm listening to colleagues of mine saying, oh yeah, I got it, it's so easy, why are you struggling? And I trusted him, and it gave me tremendous perspective because it helped me understand that I wasn't going to get out of dental school, having perfected or reaching excellence at anything. As tough as that was to handle, as tough as that was to deal with at that time, it made me understand that struggling was okay and that I wasn't going to be perfect at anything there anytime soon. What's interesting is, I have to say, probably the 10-year mark of my career is when I felt really comfortable treating teeth while looking exclusively in the mirror. And I'll admit, I still cheat and look around and check with my eyes and move to the other side of the chair, and I do all kinds of stuff just to see what I need to see, just to make sure I'm doing a great job at everything I'm doing. But the mirror, is still a struggle, to this day, but I'm pretty competent at it now. I'm in year 16. I feel comfortable looking in the mirror. So if you're a young dentist or a dental student watching this and you're still struggling with the mirror, don't worry. It takes 10 years, at least 10 years, to feel comfortable and confident looking in the mirror. There's so many things in dentistry that take almost 10 years to feel confident about, to feel strong clinically about. I think when you get out of dental school, you think you know a lot, and you do know a lot, and you can do a lot, but you gain so much by seeing your own work, seeing your own failures, seeing your own successes. There's just things you can't learn just the first time around, the first several times around, the first 100 times around. Mastery at each little part takes years of dedication. Most everybody's probably read Tipping Point, 10,000 Hours. That definitely came out after dental school, I'm pretty sure. I definitely read it after dental school. That book helped me to put things in perspective too, much like Dr. Lippman's, honest, admission to me that it took him 10 years to get good with the mirror. I have tremendous respect for other dentists, other professionals that are humble and that share those kinds of things with young doctors, with young professionals. It's just not an easy road. Dentistry is not an easy thing to master. I don't really pay attention to what's going on in other professions outside of dentistry. Dentists that I follow on social media, dentists that I listen to giving lectures, there's definitely more consciousness about mental health, giving yourself grace, those types of things. A lot of dentists are really hard on themselves, and it's part of the culture too of dentistry, of just anything in higher education. It's very competitive. It can get cutthroat. The attitudes that you have to take with your time, with your life, to get to those levels, to get into professional school, to excel in professional school, to become a professional, you got to put a lot of things to the wayside. You got to make sacrifices. At some point you realize that some of the sacrifices are intense, and you can't live that way for too long without upsetting people around you and making a mess of other things in your life. Maybe it's hard for people outside of the profession to understand. I'm sure other professions have similar obstacles and challenges. I know they do. I have friends that are physicians and lawyers and other professions that are equally demanding on the mind, the body, and the soul. I think it's hard to tell somebody who was hard on themselves as a child, as a young adult, to excel in school, to become a professional, to ease up. It's hard to ease up. I'm not even sure that's the right way to talk about it or the right thing to say. I mean, I'm still pretty hard on myself to be excellent, to do the best job I can, to be as present as possible for my patients, for my staff, for myself, for my family, all that stuff. I think it's important to give yourself grace and to be kind to yourself and to take care of yourself, but you still got to work. I mean, you still have to put the work in. You still have to care about what you're doing and going for greatness. I don't think you can just sit around and say like, oh, don't be hard on yourself and don't expect great things. I mean, you have to. If you want to do great things, you have to put expectations on yourself. You have to put expectations on people around you. I'm not sure everybody's built to handle those types of things.